Dr. Ashish Shah, SCPH plus homeopath, predictive homeopath, proud to be. Any disease, every disease, we cannot treat, we cannot cure without giving every success tribute to our master and the line of homeopathy, Dr. Vijay Garsam. My gurus who taught me edge of homeopathy and who allowed me to practice. Happy Gujarat Surat team who helped us in the position where we are today. So today is our topic, homeopathic management of psychiatric diseases. Psychiatric diseases are nowadays very common. We will encounter it in our day-to-day practice. Approach towards psychiatric cases, although we'll see in aphorisms also, it is not much different from regular cases. But while analyzing the case or processing in the case, we will need some clarity of the mind. That how should we proceed in a case of a psychiatric illness? The basic funda will remain same always, whether it is a psychiatric disease or not. But the processing, see, I always say, when Hahnemann sir wrote practical part of the organon, he first wrote classification of disease and then he wrote case taking. It was deliberate that you have to first you have to classify the disease. You have to judge that at which particular time your patient is coming in the classification of the disease, and then you should proceed for case taking. Your case taking will be according to the type of the disease. So case studies according to instructions in Organon by Hahnemann. I have tried to analyze cases and match them with the aphorisms by given by Hahnemann. Okay? How can we use aphorisms in our practice in our psychiatric cases? Unless and until we understand the practicality of the aphorisms, we will not be able to understand the process of case. So we will see the case, we will see the aphorisms, and we will see how aphorisms will help us to cure the case of a psychiatric illness. I have collected few cases. Today I will show two cases, but I have collected few cases. If the session will go in a right way and I will be able to give what I want to, then we will go forward for further cases of psychiatric illnesses, and we will see how aphorisms will help us in analyzing and solving these cases. So psychiatric illness. Many a times we will see the patients where psychiatric illness will not even be diagnosed. Patients and relatives of the patients are many a times not ready to accept that patient himself or relatives will able to accept that his relative has a psychiatric illness, because in normal terms, especially in our areas, today also psychiatric illness is considered as a insanity, is considered as a social stigma, although it is very much common. So you have to deal it with very delicacy with patients and relatives while you diagnose and you prognose. We will encounter many psychiatric cases of different types. We know the aphorism of mental disease of psoric origin are almost all those diseases that I have above termed one-sided, which appear to be more difficult to cure. See, appear to be more difficult to cure. Sir has not told it is very difficult to cure or impossible to cure. It will appear to be more difficult to cure. Yeah, so up to when we will consider it as difficult, unless and until we don't know the right method. Whenever you know the method, it will be easier. So in consequences of one-sidedness, all their morbid symptoms disappearing, as it were, before the single great prominent symptom. So what sir is telling, what is one-sided disease, where one symptoms will become so much prominent that all other symptoms will become downside. will become less perceivable, less observable, right? So then one single symptom will be considered as a one-sided disease. Of this character are what are termed mental diseases. And if this single prominent symptom is on a mental plane, then it will be termed as a mental disease. Now, when we say mental disease or one-sided disease, when you see very superficially, when a patient will come with a psychiatric illness, they will show many symptoms, many delusions, many hallucinations, many anxieties, many overthinking thoughts. But this is all in a one symptom. This is one symptom. That's why it is called as a one-sided disease. Then one faculty of mind, the subtle organ, mind. Hahnemann sir has used the word subtle organ. The subtle organ, mind, is affected at one part. Either it will be moral or conscience or intellect or cognition, anything. That one function will be altered, and all symptoms will be around that. So mental disease, they do not, however, constitute a class of disease sharply separated from all others. Since in all other so-called corporeal diseases, the condition of the disposition and mind is always altered, and in all cases of disease, we are called on to cure the state of the patient's disposition, is to be particularly noted along with the totality of symptoms. If we could trace an accurate picture of the disease in order to able, therefore, to treat it homeopathically with success. So we know what we do in our regular cases. This is all what we do. We take a case, we make totality of symptoms, we make disposition. Yeah, here sir has written in all aphorisms, sir has written importance about mind and disposition. That you have to select the medicine from disposition and you have to cure the dispositional errors, right? So in regular cases, what we do, we make totality of symptoms, we match the medicine from disposition, and we prescribe it. The same thing we have to do in mental disease also, right? But the totality of symptom and disposition matching will be slightly different because the mind is diseased. In further aphorism number 215, almost all the so-called mental and emotional disease. So we know the meaning of so-called. They are not really mental disease. As far as told about the one-sided disease or local disease, there are no true local or one-sided disease. It seems to be a local disease. It seems to be a one-sided disease. Similarly, it seems to be a mental disease. It can never be a only mental disease. So almost all the so-called mental and emotional diseases are nothing more than corporeal diseases in which the symptom of the derangement of the mind and disposition peculiar to each of them is increased. Right? Peculiar to them. Mind and dispositions peculiar part will be altered, will be diseased, which the corporeal symptoms decline. So corporeal symptoms will be there, but it will be in a declined mode. So we will not be able to perceive it clearly. More or less rapidly, depends on the speed of the case. See, it at length attains the most striking one-sidedness, almost as though it were a local disease in the invisible subtle organ of the mind or disposition. So it will appear to be a mental disease because all other symptoms will be declined. We will not be able to see the corporeal symptoms, and that's why we consider or we falsely assume that it is a mental disease. Now, let's start with a case. It's a case of a health anxiety OCD. OCD with hypochondriacal anxiety. What it is? OCD with hypochondriacal anxiety is characterized by intense obsessive fears. Vijay Krishna sir have explained us about obsession and compulsion. Right? What is obsession and what is compulsion? Keep this thing in your mind. So characterized by intense and obsessive fears of having a serious illness paired with compulsive behaviors like excessive health checking or reassurance seeking is most commonly termed health anxiety OCD. While formerly known as hypochondriasis, the modern primary diagnosis is illness anxiety disorder. Health anxiety OCD, a subtype of OCD focused on the obsessive behavior of contracting or having a severe undiagnosed disease. So, anxiety of health will be the symptom. Remember again the aphorism number 215, 210, what we have just so. That one symptom, and that is anxiety of health, will reach at so much intensified level that anxiety becomes single prominent symptoms and all other symptoms will be in a decline. There will no any other symptoms visible, perceivable in that particular patient. Only anxiety over health in an intense level we will see. And all symptoms will circle around it. Now, all symptoms will anxiety, and it converted into OCD. OCD means impulsively the patient will demand, okay, I want to check my this report, I want to check my that report. Anxiety of health will be, there will be symptom and patient will be anxious. Hypochondriasis will be, there will no be particular symptoms or very lesser symptoms will be exaggerated. But when it converted to OCD, patient will find out which part of my body is diseased, and he or she impulsively will check about the diagnosis of that particular disease. And it is easier in this Google era, especially now ChatGPT will put a symptom and ChatGPT and Google will tell the list of diagnosis. Then patient will go for the assurance and checking of the report. So let's start with case. So 16-year male, or you can say 16-year boy, studying in 11th standard. First, the case was given by his mother. So what his mother told us that right now he is complaining of disease, decreased appetite and nausea since 3 days. So when patient came to us, since 3 days he has decreased appetite and nausea, which he is complaining about breathing difficulties, and she said okay, he always told about that he has some major illnesses. In last February, he got a white spot at penile region, some white spot at penile region, where he applied some Ayurvedic ointment. He was thinking as if he has a cancer or AIDS. 16-year boy, never have any sexual contact, but he thinks he has some STD or AIDS or a cancer. When he was in 10th, he topped in his school. So very good intellectual person. He read aggressively. He didn't even care of his food while reading. So his mother told that I have to deny sometime that leave reading for a while and play or sit with us, talk with us. But he never left his studies. Continuously, aggressively, he was reading, reading, and reading. He was complaining. He is complaining of abdominal pain previously. When before 3 days, we consulted a pediatric and MD. They also did USG, which is completely normal. That was also insisted by the patient. To do my USG. He was insisting to do CT scan or MRI. My disease will not be able to be diagnosed in USG. You have to do higher investigations. Even he was ready for endoscopy. Google era again. He has read everything about Google that how a cancer can be diagnosed. Once he said he had accumulation of the mucus in chest. He searched in Google and said he has lung tumor. Previously, he said he has slight breathing difficulties. Then he said, I have a chest, I have a accumulation of mucus in the chest, and I am sure I have a lung tumor. Again, he was insisting to do CT scan. He never goes to play with his friend. He just read and read alone. His mother advised him that do studies in a group, but he never accepted this advice of his mother. He always read and read alone, never with anyone. He never eats outside food outside of the home. Only eats sometimes, only if it's Saturday evening. Whenever there is a birthday party or any any function, if insisted, he will go in the party or in a function, but he will never eat food there. He will only eat food only and only if it is a Saturday evening. He doesn't take care if me, his father, or his brother is sick, but he must remain well. So his mother told in Gujarati કે ભાઈ એને કાઈ ન થવું જોઈએ. If I am ill, his father is ill, his brother is ill, he never take care of any of us. If anything happens to him, he will cry whole day. He will literally cry. What he will do, what he will say, he will take one of his cloth piece. He has the favorite shawl which he is taking since childhood. He will take this shawl and will continue to cry and cry and cry as if he has a veil in a forehead. This is a well-known Kathiawadi dictum, Kapadma Kuo. He cries so much. 16-year boy crying for disease. He is very good in study since beginning. He reads like an insane. He is also good in cricket, chess, football. But since 10th, he never goes to play. He shuts the door and reads inside the room. Since childhood, he is very good in studies. His mother told that we never have to tell him to do his homework. He will do by self, right? But since 9th, 10th, he is reading like an insane. But he never feels well. He is always in a bad mood. He is never well. In a complete melancholic mood he is. His nature is cool and calm. He never gets angry. He is very fearful. He will not go to kitchen if light is off. A 16-year boy will never go to kitchen if the light is off due to fear. Now we have to ask the mother that since when he is having such kinds of complaint. So he is searching in Google for his disease and is too much worried about health since 7th or 8th standard. His mother told I cannot exactly correlate because it was gradually increasing. It is not like from the next day he is doing like this. It was gradually increasing. But I can say that since 7th, 8th or 9th, he has so much increased anxieties. But it is increasing and becoming regular now. But nowadays, since 10th, means since last 1 to 1.5 years, it has increased very much. Every other day, he finds out new symptom and new diagnosis. What he will do, he will have a symptom which is totally imaginary. He will go for diagnosis to a pediatrician or a MD for 3 days, 5 days, 7 days. He will run behind that symptom. Ultimately, he had to convince himself that I do not have symptom. 2, 3 days, 4 days will pass and new symptoms will be there. And now the same cycle will repeat. This is OCD. Patient is finding symptom in himself. There is no symptom which is being exaggerated. Patient is finding symptom in himself. We consulted so many pediatrics and MD, but he never accepts that he has no any major illness. So I had to ask, okay, what was the worst situation which has happened before 7th? Because there is no past history, no such major past history. In such kind of cases, remember, past history will be very important. It will guide you that what, see, now we understand mind of pathology. So for understanding basic disposition, the past history will help. Whether his disposition, whether his need is insecurity, whether it's esteem, whether it's love, we can judge from past history, right? Because here the disposition will not be clearly defined because the mind is diseased, right? So we have to judge it from childhood and the previous history when the patient was not sick. But no major past history was there in this particular patient. But what has happened is in 5th standard, once the boy had loose motions, he was in school and he got urged to pass the stool. But before he can reach to the toilet, his stool passed in his pants. He came home crying that everyone was laughing on him. Since then, he goes to school without any food. After that day, he never have a breakfast because he continuously has a fear that this can happen again. Right? So this was the incidents which triggered the illness. Now let's ask the patient. Patient told, I have a nausea and my appetite is decreased since 3 days. I think my hemoglobin is decreased or my sugar is decreased. And that's why I have a nausea. That is what told by patient. Right? Because I have a hypotension or anemia or hypoglycemia. And that is causing my decreased appetite and nauseating feeling. Or I think I have a pain in kidney region. So I think my kidney is failed. I have a kidney failure. This is told by the patient after all reports done. Right? Then I am having nausea that may have to lead to decreased hemoglobin, decreased sugar. Patient is telling by himself. I have not probed anything. He is telling. My weight has also reduced from 63 kg to 55 kg. This is in last 1 year. His weight is really reduced from 63 to 55. My hair also have become grayish. I observed not a single hair was grey. But he was telling my hair become grayish. I was having orange urine, so I think I have a problem in my liver too. Bilious urine, he must have read somewhere. But he doesn't have a yellow urine, he have a orange urine. Any medicine clicking from him? I was not going in vacation classes as I was assuming about major disease. So 10th was completed. He took admission in science. Vacation classes starts. But he told I am not going in my vacation classes. Who is telling, who is so much serious about his reading and studies, that I am not going in my vacation classes is I was assuming about major illness. I used to overthink when I am alone. I search in Google and think I have a big disease. What his parents did, his parents took mobile from him. That we will not give mobile to you. What this boy do? By some way, he find mobile of one or other person. When his father is working, he will take his mobile and search in that. Or he is going in school. Nowadays mobiles are common in schools. He will take mobile of some friend and he will search in that. Right? So he will find some or other way to search in Google. What if the disease will increase? There can be so many problems. I even can die. Because my kidneys fail, my liver is diseased, I have a lung tumor, I have all the thing from where I can die. I already had pressure of exams. This is he is telling about board exams. Now this has increased my stress. So in February he had that penile spot. He is telling about that. Okay, I already had exam pressure, and this anxieties and this overthinking is increasing my stress. In board exams, what if I get less marks? In February, when he get thoughts of cancers and STDs, he was worrying about his marks. What do you feel? I worked so hard. Now I got less marks. What do you feel if you get less marks? So much money was invested in tuitions and then also I get less marks. What neighbors will think that he is not good in his study. What was he was worried about? That what others will think that he is not good in his studies. These all things are important. Minor things. When you are dealing with mental disease, with psychiatric disease, more than symptoms, focus on this kind of symptoms or this kind of words of the patients. This will help you to find the disposition. Right? All other common symptoms of the disease, we have to put them all aside. What do you feel about that if others will think about you? I would feel very bad. I would feel embarrassed. I would feel guilty. I would have a self-doubt as if I really didn't read well. I will think I was a failure. What about your overthinking? I think my family doesn't understand me. I cry. I am having so many complaints. And that's why I am telling to you. But my mother always calls me. His mother always calls me. Him that you are assuming, you are not believing. We have done so many reports for you, but still you are not accepting. She thinks I never cares for them, but I have problems. Why are you not understanding me? Once I had a spot at penile region. I thought I have a vitiligo or some STD. Incidents behind that was he read somewhere in newspaper or in social media that STD can be like that. Actually, he doesn't have a spot also. It was also in his assumption. Now, I asked about his incidents. What has triggered the situation? What has happened in fifth standard? So he told, I had sudden urge to pass the stool, but I couldn't reach to the toilet and pass the stool in my pant. What was your situation? He said, my reputation was lost. Everyone was looking at me with some different vision. Everyone was looking at me with some different vision. Then I had to divert my mind to study. So what happened? He was good in studies previously also. But now, to deviate from the thoughts, what was happening around him, that everyone was laughing on me and everyone was looking me with a bad vision, he focused more on studies. And resultant effect was he got a ranker mark. He was good, but now he became ranker. Since then, I started to work. I got good marks, and everyone in class was appreciating me. So this was the trigger point. Here we have to understand what the situation has occurred. First, there was a situation where he passed the stool in his pants, and everyone was laughing on him. Now, he, to divert from that particular incidents, focused on study and got good marks, and everyone in class were started appreciating him, who were first laughing on him, right? So situation converted. This makes him red like an incense, right? This make him red like an incense, and this make thinking him that what others will think if I got less marks. Everyone should look to me as he is the boy who has good marks. Now I have a good reputation. Why should I spoil it? So my reputation was lost, and now I have a good reputation. I have to maintain this reputation. This feeling went up to the insanity. I don't eat outside food. So what his mother told, he will eat food only when Saturday evening. Why? Because the next day is Sunday, and Sunday doesn't have schools, right? That's why he eat only on Saturday evening. Otherwise, he will not eat outside food. So this was the symptoms and disease narrated by the patient and mother, right? Now, what are other mental conditions? So, what you fear of? I fear of death. It can happen at any time. I fear I have white hairs. Everyone will make a joke of me. So, these incidents, this is need of the patient. This is sensitivity of the patient, right? And Hahnemann sir told us mental diseases are of which miasm? Thora. Thora means you have to find out sensitivity. So here patient is telling about his sensitivity. Forget all symptoms. Focus on this sensitivity. I fear of dog, it can bite. I will have to take injections. I fear of ghost of horror movies. First less, sleep is good. Sometimes I feel asleep after crying. He cried whole day. And many a times he fell asleep in crying and crying and crying after tired of crying. I took my favorite shawl. I carries it always. It has a particular smell. I like that shawl because it has a particular smell. So I never let it go. Dreams. Someone died in the home. Whom? Mother or father. What do you feel? What will happen to us now? I will feel bad. If my mother or my father will die, what will happen to us? Who will take care of us? And next, I topped in exams and I am being awarded on the stage. Right? So that is my need, what is being reflected in the dreams. Other mental generals, what about your family relations and life? My mother always compares myself with others. My father always tells me that I am very weak. Nobody understands my problem. Brother, I sometimes do mischief with him. He complains about me to the mother, and my mother will take always his side. She will listen to him always. Hobbies, I want branded and luxury items. My father likes Jaguar car. I wish I will buy that for. So now we have the case. We have to proceed in the case. But for that, we have to take help of Hahnemann, sir. Right? Then, in whole case, where we will focus, from where we will make totality of symptoms and disposition, from where we can prescribe. So, aphorism number 214. The instruction I have to give relative to the cure of mental disease may be confined to a very few remarks. Sir is telling I have to not, I have, but I do not need to give many remarks about treating mental disease, as they are to be cured in the same way as all other diseases, namely by a remedy which shows by the symptoms it causes in the body and mind of healthy individual. Matlab, drug proving. What we find in drug proving, we have to match in our patient. A power of producing a morbid state is similar as possible to the case of disease before us, and in no other way can they be cured. Means sir is clearly telling us that in footnotes, we'll see in further sessions, in footnotes, in aphorism, sir is clear about, okay, don't try to give assurance to this particular kind of patients. Assurance, counseling, personality trainings, this will not help these patients. They can aggravate this particular type of patients. Don't focus on that. You are not to counsel, you are to cure. Counseling can palliate. You have to cure these patients. And only way to cure, no other way they can be cured. Only way to cure is prescribe the remedy which have capacity to produce the similar disease. That is similia similibus curanter. So find the remedy which has produced similar kind of symptoms which you are encountering in your patient. No other way it can be cured. I am telling this before, these kinds of patient will need counseling from you. And I am telling you, okay, many a patient, if you are not able to find right medicine, many a time it can happen with all of us, right? And if you focused on counseling and you are not able to find right medicine, they will come to you with counseling regularly. It will not help to you, it will not help to your patient. They are only coming to you for counseling, right? That I want to tell this thing, I want to tell that thing. My XYZ relative is doing this thing with to me. I have this kind of thoughts, I have this kind of dreams, I have this kind of delusions. Just to express themselves. Don't counsel. Sir has told in further aphorisms only one type of mental disease. We know how many kind of mental disease are there? Four, right? Only one kind of mental disease, and that is also part of that disease where you can counsel and it will help only partially. Right? So don't counsel. Only focus on finding the right medicine. The second negative point, what will happen to you when you will focus on counseling? You cannot focus on finding the right medicine because now you have a sympathy for your patient. To counsel, you either have to apply your intellect or your emotion for your patient's symptoms manipulation. This is not your work. Your work is to find the medicine. So whenever you focus on counseling, your focus will be diverted to the counseling from finding the right medicine. So don't counsel and focus only and only on right medicine. I am telling you because patient will tell that counsel me directly or indirectly. Always tell them I will give you medicine. Right? The further kind of aphorisms, this holds true to such an extent that the state of the disposition of the patient often chiefly determines the selection of homeopathic remedy as being decidedly characteristic symptoms which can least of all remain concealed from the accurately observing physician. This is 211, and we read the aphorism 210. So what we need to do now when we have a case of this kind? We understood that mental disease is not a different disease. It's a disease where one symptom has become so much prominent that all other symptoms are declined. Right? This is clear. So now the symptom which has become so much prominent, find the characteristicness of that symptom. Find the characteristicness of that symptom. If in this patient that anxiety has become prominent symptom, find the characteristicness of this symptom. Vijay Krishna sir has told when his first seminar was in Surat, he told that when you encounter this kind of patient, find the most weirdest thing in this patient. Most weirdest thing. That most ask to the patient or observe the patient, or moreover you will get this information from the relatives, that most weirdest thing done by the patient. That will be the most characteristic prominent symptom. Understand this symptom. Don't directly take it. Don't directly take it. Only understand this symptom. Aphorism 220. By adding to this state of the mind of the disposition, I am not reading, I am telling you that you first will take the most prominent symptom. Now, the basic mechanism of mental disease is Sora. So, combine the most prominent symptom with the soric symptom of the patient, means the sensitivity of the patient. Right? Take this both ends. The journey will help us to find the disposition. It is important, but it will help us to find the disposition. The focus to understand disposition. Find the sensitivity from where the patient has started his illness, and at this particular time, what most prominent symptom is coming against you. In one more thing, lasted some time. So when you have we know the acute psychiatric illness, we need to first prescribe the acute medicine. Maniacal medicine, belladonna, Alzheimer's has given examples. So this is not this kind of a case. When it has lasted for some times, we need to give antipsoric medicine. Right? Unless and until it is an acute exacerbation. Then we have to give state medicine, and after that we have to give antipsoric medicine. If it is lasted for some time, then we have to give antipsoric medicine. So how can we focus? So always understand the presenting complaint. Don't take symptoms directly. Anxiety, delusion, hallucination. We will not take it directly. Only understand it. Find out the proper history from where patient has started to become abnormal or change from normal behavior. Means when the sensitivity of the patient is getting hurt. The disturbed sora, this disturbed sora will help you find out the remedy. Always remember, mental disease is just similar to normal disease. Only focus on differentiating mental symptoms, means disease symptoms, with mental generals. This can happen to us many a time that we will confuse the symptoms of disease with generals of patient. We'll take them as a mental general. Don't take them as a mental general. They are mental symptoms. So now let's focus on. We have the direction of Hahnemann. Now we have to focus on this particular case. So, you want to discuss, or I will continue with the case? Anything you want to say about the case? Suggestion, rubric, medicine. Anything? Yes, we can take embarrassment. It was embarrassment. Yes.
The delusion, imaginary things he has.
Yes, this is mental symptom. This is exactly the mental symptom. So patient has this symptom, but it's a common symptom of the disease. So we will not take it. That is what I was telling. Okay, differentiate common symptoms of the disease. This is exactly the common symptom is. When patient will have a corporeal disease, and this kind of symptom is there in the mind, then take this symptom. When mental mind is in an error mode, don't take this symptom. You will find the pathological medicine, not individual medicine. Any other? Mania to read medical books, impulsive thoughts. So that we can take. Yes. Fear of others' opinion or sensitive to opinion of others. Yes. That is also there in disposition. Clinging to furniture. The soul is being carried away every time. So clinging is there. Yes. For a particular smell, that is also important. He likes that particular smell. Broad clinging we can take. Yes. Yes. Any other? Fear of death is there. Again, it will be a mental common symptom. It was not delusion. It was really. Yes, it was reality. Mortification. It was mortification. Yes, and from that he went up to insanity level. Yes, we can take this rubric.
Fear something bad.
Fear something bad will happen to him. Yes. Should I? Yes. So I took the rubric humiliation elements from aggravation. Broad rubric where embracement is covered lesser than mortification. So that's why we can take mortification also, but I took humiliation, anxiety, hypochondriacal, the symptom which has aggravated to ultimate level, and unsympathetic. That rubric I took as his disposition. He is not taking care of anyone. Platina, Netramure, Pulsatilla, Staphysagrina, Chamomilla. And you can see also other medicines, although they are not covered. So any suggestion from this? Very easy. Pulsatilla? No? Why no? If no, why no? કપાળમાં કુવો તો છે પલ્સેટિલાનો એફેમિનેટ તમે કહી શકો. But I ruled out Pulsatilla because he is never well with consolation. Consolation never helped him. Right? Yes. Platina. Esteemed remedy. We want esteemed remedy. His esteem is getting hurt everywhere. Right? Netramure is also there. Pulsatilla, Netramure, and Pulsatilla. These three medicines I thought. I differentiated. Pulsatilla I ruled out because consolation was not helping. In this particular kind of situation, you assume that Pulsatilla will be helped with consolation. Netramure, why? Anyone can say why Netramure is being differentiated or is being ruled out? Anyone? Very easy. Why Netramure will be ruled out? He is crying alone. He is crying alone in his room. But he has no any emotions with his parents also. He is not attached with the parents also. Netramure is being ruled out from there. Right? So we want a medicine who is self-centric, who thinks I am something and everybody else are of no value. I am only the valued person. So Platina was given. These are some few rubrics of Platina also. Embracement was told. Embracement, aggravation, elements from mental and emotional consequences of Platina is there. And Kapadma Kuo, anxiety, health about weeping with. Platina is there in that rubric also. Anxiety about health with weeping. I just saw this rubric. I didn't take this rubric. These are just confirmation. And I confirmed from the materia medica also. Right? So, great fear of death, which is believed to be very near, accompanied by trembling, palpitation of heart, obstructed perspiration, sensation of dread and horror. This is written in mind of Platina. We only know Platina where haughtiness is there, but this is also haughtiness. That is what I was telling. Okay, when mind is altered, your exact disposition will not be so easily visible, right? So find out the disposition from previous history. From we cannot think that this kind of person can be haughty, who is crying whole day, but he is haughty because he is cutting all of other his relatives, right? And he thinks I am only valued person. And when he got altered or disturbed sora, when his esteem is hurt, right? So that is esteem of Platina. So Platina was given. Platina cured him. The case is cured. I have a video, but I will show it afterwards due to respecting the privacy of the patient as the lecture is being recorded. We will see it afterwards. Right. So any question in this? Right. If there are, we can encounter it afterwards. Let's see another case. Case of a generalized anxiety disorder and associated depression. Right. And you will find in this case the symptoms which are much more than this. 24-year male patient. He is 12th pass, working as a graphic designer. April 2025 no case है. Observation: he was very shy, timid, has continuously restless legs. You can see his timidity and nervousness directly. He was stammering. Stammering was there since beginning. And he has dryness of lips, especially lower lip. What it suggests? Dryness of lips, lack of love. Past history, here we have past history. So after birth, that boy didn't cry properly. He was only mourning for 2 to 3 days, and after 2 to 3 days, it was 1 to 2 days, not 12 days. Days ada out of it. So after 1 to 2 days of birth, he cried properly. Until then, he was just mourning. He had febrile convulsion at the age of 20 days. His milestones were delayed, especially walking and talking. Walking was at 2 to 2.5 years and talking at 1.5 to 2 years. He had bleeding in stool. They didn't have files, but they in layman terms said that their doctor told them that he had ulcers in intestine when he was in 5th or 6th standard. After that also he has once or twice bleeding in stool. Chickenpox in 11th standard. This is his past history. Chief complaint by patient: sleeplessness and overthinking. Fear: I will die or I will murder someone. I will kill someone with knife. I get thoughts to kill newborn babies and I fear I will do it. The patient is unmarried, right? And he has thoughts that he may kill a newborn baby. Why? We'll see. My friends were talking about sex. We're talking about how a child is being born. I don't like to do all that things. What about sex? I feel all these things are false. They can never be true. What is being performed while mating, this can never be true. These are all false things. They are telling false things. My friends were continuously talking about that. Were teasing about me, about that, teasing me about that. I got fear about that. Is it like that? Are these things to be done really? Should we really have to do this thing with women? Should we touch them like that? Should we do this like that? It cannot be true. I am frightened about doing all these things. I get thoughts at night. What if I will kill my own child? Why? If I will, what will happen if you will kill your child? If I will kill my child, everyone will beat me. If a child is born, why you will kill your child? Because a child is born by doing all these things. So why he has thoughts of killing own child? Because he is thinking that to give a birth to a child, a person a male has to do these kind of things with a female. And I fear this kind of things, and that's why I fear that if my child was born after doing this thing, I will kill him. I may kill him. Since 6 to 7 months, I have increased thoughts about that. Why? Because friends' talks are increased about sex, and in my home there are talks about my marriage. So since last 6 7 months or 1 year, his friends, his colleagues, where he was doing work job, were continuously talking about that. And we know the boys' friends when one knows that he is being teased by this, all become higher famous, and they will like to. So that is what happening with him. But the other triggering factor was talks about his marriage in his home. Did you have any relationship? He told, I had a friend. I proposed her, but she denied. I felt bad for 3 to 4 months. This has occurred before 4 years. Did you do masturbation? 2 times a week since 7th or 8th standard. Don't you think of a woman or of a female of a girl when you are masturbating? No, without thinking anyone. So he's telling, I do masturbation without thinking anyone. Hello. So why you fear about sex? He told, I fear even touching a woman. I fear if a woman touches me. So I fear to touch a woman, and I also fear a woman touches me like that. She can touch me anywhere. And that's why I don't want a child. Because for that, I will have to perform sex, and I will have to allow a female to touch me, and I will have to touch a female. So that's why I don't want a child. Other things about other general nature about the patient of the patient. He said, I get fear if someone talks about Chudel or ghost. We were watching a movie Three. Everyone must have watched. I asked them to stop it in between. I was watching with my cousins who are younger than me. They were ready to watch, but I got fear. What fear? What if it will come out and come here? It's ghost from the movie will come out from the TV and come here. Other things, I don't like loud noises like DJ. In loud noises, my eyes starts blinking continuously. This is a sign of again fear. It's trembling, kind of trembling. Any anger? If someone tries to find my mistake, I will have anger. I am working hard and good, but they do not appreciate that. I feel I should leave my job. So he's telling, okay, in my job, my colleagues, my boss do not appreciate me, and they always find my mistake. That's why sometimes I get a thought that I should leave a job. My friends tease me. They say you do not understand anything. They say to me that you do not understand anything because I have a problem in speech. They always neglect me and my work. They tease me because I have a problem in my speech. Yes, stammering. I am weak in talking. I can't speak clearly. Sometimes strange words come out from my mouth. He is stammering in particular letters, and he can stammer at any time. Sometimes when starting, sometimes in between, sometimes he will stop. It will happening. It was happening in case taking also. And sometimes out of nervousness, some different words will come out from his mouth. So others will think that he is not understanding because he is not able to express it properly. History by his mother. He talks with me open heartedly. One day he came to me and said that he may kill if he will have a child, as he will have to do sex for that. He was not ready to believe that it is reality. He asked me, is it really that one have to do all these things after marriage with woman and to have a child? So this is history giving by his mother. His mother is telling that the patient, the boy, a 24-year male, came to his mother and told that my friends are showing me these kinds of videos and telling that you will have to do these things after your marriage to have a child. I don't believe them. So he's asking his mother, is it true? Is it really that a person has to do these things with a female? It can never be true. You tell me. He said, my friends are showing bad videos to me. He was very fearful after that. He said he has fear to do that. He becomes annoyed if there is any talk on that matter or about his marriage. So he told that if we talk about his marriage in home, he will be annoyed. Since when he came to know about these things, he had similar complaints before 1 to 2 years. So when patient came to us, the complaints were since 6 to 7 months, and he was on a psychiatric medicine. But similar complaints occurred before 1 to 2 years also. At that time, they took antipsychotic treatment for some times, and then they themselves stopped. After sometimes the episodes recurred, and right now also he is on antipsychotic medicines. But this time it is very severe. In childhood, he was obstinate, was not doing homework by self, opposite to that particular child in first case. He fears from his father, so he never tells anything to his father. Analysis. So this is the case, right? We have to analyze from here. Any particular thought, any particular idea? Go. તમે પછી એના પછી એનાલાઇઝ કરજો ત્યાં સુધી તમે વેઇટ કરો બીજા anything, any particular symptom, any particular rubric you are thinking? Indifference to sex, yes. More than indifference, it is aversion. It is aversion more than indifference. Aversion poison, yes. I reveal. I took the rubric insanity, madness, erotic, sexual. Sexual thoughts made him insane, and fear of killing her own child. This is syphilis, right? So I took these two rubrics: Naxomica, sulfur, and Mensinella, and medicine is Mensinella. So I prescribed Mensinella. One more rubric of Mensinella: insanity of losing one's reason, killing her child. This is direct rubric, and only medicine is Mensinella. So this rubric confirmed Mensinella, and I prescribed Mensinella. Follow up. First follow up, he was better in thoughts, but mother told that allopathic medicines were also changed. The next day, they started the homeopathic medicine, so they cannot be sure which medicine has helped them. So I prescribed Seclec. Follow up after next 15 days, he was better. What is the thing you look for? In follow up, you will ask about overthinking, you will ask about sleep. But what was the main question we need to ask? we need some moralistic attitude. I will ask, is he ready for marriage or not? But before that, when will he be ready for girlfriend or marriage? What was the question? What can be the question to decide the follow-up, to decide the right homeopathic medicine, not right treatment? They are telling he is getting better sleep, he is getting reduced in his overthinking. Yeah. Yes. So the question is, what you think about your child and performing sex? Because performing sex is basic need of living creature. No, it is a basic physiology. So I asked this thing in third follow-up. He told 10 thoughts. He was better in overthinking. He was better in sleep. But his mindset about sex and child has never changed. What does this indicate? Our medicine is wrong. Right? So what Vimal sir was telling, anything you got about in maternal history. I asked maternal history in first case, but what mistake was done? What mistake was done in this case? We saw past history of the patient, right? What was the specific thing in past history? What was the specific thing in past history? What you can analyze from the past history? Epilepsy, stammering, milestone delay, doesn't cry for properly for 2 days. What does this indicate? Basic disposition of child is fearful, right? And right now, does he have anger from sex? He have fear from sex. He's frightened by showing this video. You cannot tell that he's angry. Ah, you are doing this thing. Or he is conscientious. Oh, these are bad things. You should not do this. He's not conscientious, overly conscientious, or overly angry. He's fearful. So what has happened in this case? He has fear right from the birth, which has aggravated to mind. Remember the chart of suppression of Vijay Karsa. This will help you. This is progression of the disease up to the 7th layer. And what mistake was done by me? I directly took the 7th layer and didn't focus on Sora, mind and disposition. Right? The basic Sora was not touched. The basic mental disposition was not touched. And the same thing which I was denying in the first case, I did. What symptoms I took? Common symptoms of the disease. Right? But didn't analyze why this thing has happened. So, what in aphorism number 216? This is somatopsychic disorder. Right? This is somatopsychic disorder. This is importance of classification of disease. Right? So, in this manner, they become transformed in paragraph. I have written second paragraph. Transformed into a one-sided as it were a local disease in which the symptoms of the mental disturbance, which was at first but slight. So mental symptoms of fear was there, but it was slight. Increases so as to become chief symptom. That slight fear become chief symptom. And in a great measure occupies the place of all other symptoms. The corporeal symptoms was there in beginning. But what happened right now? All corporeal symptoms declined. And then mental symptoms took place of all of them. So now we have just symptom of mind. That is what told by Hahnemann. It is so-called mental disease, where it's actually a progression of corporeal to the mental disease or symptoms changes, transformation of the symptoms from whole to only mind, whose intensity it subdues, corporeal symptom, it subdues in a palliative manner. So that, in short, the affection of the grosser corporeal organs become, as it were, transferred and conducted to almost spiritual, mental and emotional organ. So, 3 words are used. Always read every word. Spiritual, mental or emotional organ, which the anatomist has never yet and will never reach in his scalpel. So has become to the level where anatomist cannot reach. Either it will be mental, or it will be emotional, or it will be spiritual. Any of these 3 particular part will be altered, will be diseased, when corporeal symptoms will be declined. Right? So in this type, this case is there. Right? But how to proceed? Next aphorism. In these diseases, we must be very careful to make ourselves acquainted with the whole of the phenomena. Where we have to be acquainted with the whole phenomena. So don't just take particular symptom. Understand and analyze whole phenomena. Both those belonging to the corporeal symptom and also indeed particularly those appertaining to the accurate apprehension of the precise character of the chief mental symptom. Chief symptom, this is right now at the mental plane. So, what do you mean by the whole phenomena? Understand the whole corporeal symptoms and aid it in the chief mental symptoms, right? Of the particular and always predominating state of the mind and disposition, in order to discover for the purpose of extinguishing the entire disease among the remedies whose pure effects. This is written about drug proving again. So we have to understand whole phenomena, that how a corporeal, the holistic disease, where the symptoms were at body, were at mind, although at mind it was very less, how it become so much evident, so much prominent in mind, and all the symptoms of the body has become declined. So as I told, I have taken mother history in first case, but unfortunately or by mistake, I didn't reportage on that basis. So mother history, mother told she was married in 1999. The patient is her first child, was born in 2000. I had vomiting up to 4 to 5 months daily evening. I was feeling very uneasy due to that. What about delivery? It was done at home in village. Baby was not coming out, so had to put a cut. So she started labor pain, but baby was not coming out. The head of the baby was not coming out. So has to put a cut. Again, what this thing reflects? Baby is not coming out means fear, clinging, fear, right? So fear is there since intrauterine life, not since birth. I had fear of labor pain. So I asked, any fear you had? So she said, I had fear of labor pain. Will child be normal or not? I wanted to do it in hospital, but elders of home denied. Everyone told that we have done it home, nothing happens. We'll do it in home. So I had to follow them and do it in home, although I wanted to do it in hospital. But again, this fear is not coming remarkable. So I asked, anything which has happened unusually to you during pregnancy, especially which has caused fear. So she told, there was a lady residing near our home. Her eye was very evil. ખરાબ નજરના બેન હતા. ખરાબ નજરના બેન હતા. Her eye was very evil. I feared she would do something bad to me or to my child. That her evil eye will do something bad to me or to my child. I would have some problems in my delivery. I was fearing I will have a problem in delivery. I would be ill or have a fever, or I didn't like to come, or I will have a fever. I didn't like to come in her vision. I tried that I will not come in her bad eye. I didn't want to see her face or show my face to her. I didn't wanted to show her face, and similarly, I wanted that she also must not be able to see my face. Right? So fear is from here. Now analysis. હવે સાચી દવા મળી. Now any suggestion? How can we proceed? Yes. This is important thing. Why the fear is only on sexual aspect? If you crack this question, you will have your rubric and medicine.
Here, moral alternating with sexual excitement, obliquity.
William take single medicine. Sexual thing and moral obliquity. Again, he is not telling moral. He is not telling conscience that this is bad thing. He is telling, I am fear. I am fear from this thing.
Sexual aspect my incident and every fear. But
we had to put a cut, and that's why fear of this thing. Then see, if she will have a, well, the baby will be girl, then she will have a fear that I will be have a cut on this thing. My boy will have a fear.
During the pregnancy, intercourse
no history was found. I never asked also, but no history was found. Anyone?
એ બાબતે એવું કંઈક ખરા કે આ પેઇન જે થયું આ પ્રોબ્લેમ થયો સેક્સ જ છે કારણ સેક્સ્યુઅલ બિયર એટલું ડિલિવર બેબી એટલું
Then again, it might come in a baby girl. Delivery, sexual things, this will be in a baby girl. This is the main question. And Hahnemann sir told this similar thing. That find out which feeling, which thing has become so much prominent that all other symptoms are being declined. His feeling where it has become so much intensified, it has become so much at a delirious level, at an insanity level, at a maniacal level, that all other symptoms are being declined. All corporeal symptoms are being declined. These symptoms become so much and so much prominent and characteristic. This is what Hahnemann sir taught. I give a hint. Just understand. Don't take disease symptoms. These are disease symptoms. Don't take disease symptoms. Understand the reason behind, or try to understand the reason behind the fear. Suggestion? Any suggestion? It cannot be a rubric. It can be a suggestion. Your side also. Anything. Yes. Pursued. Somebody is telling about pursued. Possessed. So bad eye, when there will be a part of a bad eye, possessed will be there. But I didn't take possessed. I thought about taking delusion possessed. But why I didn't take? Because she is not telling that I am suffering because she was looking at me like that. I fear that she should not look at me and I should not look at her. Yes. Yes, a particular person, he was thinking that that particular lady has a bad eye, evil eye, that can damage herself or her baby. And now she doesn't want to see her face, she doesn't want to show her face, show her face to him. One thing we had in history, that if we think that he had a aversion, that similar mistake I did in first time. I was also trying to analyze it's why he is not wanting sex, why he is not wanting sex. But he was doing masturbation. He was doing masturbation. But how? Without thinking of a girl. Aversion to opposite sex, or why? Now correlated with aversion to opposite sex, similarly correlated with the fear of mother. What fear mother had? That this woman has the evil eye. I don't want to see this woman. And what the child perceive? That every woman can have evil eye. I don't want to be touched, or I don't want to touch any woman. When he tried, when he tried in relationship also, this is also important thing. We asked, but he didn't have a relationship, so he didn't reach there. His relationship didn't reach up to the physical touch. Right? So whenever first time he had a thought that there can be a physical touch with a woman, his fear got aggravated. He had this fear since intrauterine life, but now his fear has aggravated. So one thing was coming since intrauterine life, and now it has become chief prominent symptom. The similar thing which has occurred in a previous case. One thing was since intrauterine life, means what we have told, that sora, disturbed sora. The disturbed sora was in intrauterine life. It is coming in his entire life, and now it has reached up to the level where he did not want any sexual relationship, right? Even while masturbating. So I took the rubric fear of evil eye, and women aversion to. Women aversion to. I don't want any woman. Although while I was masturbating, I don't want to imagine of a woman also. I don't want a woman to be touched by me or a woman touching me. So he has a woman aversion out of fear. The basic thing was fear. In previous case, the basic disposition was of esteem. Here, the basic disposition is of fear. The fear of evil. You know from where this fear has came, right? This fear has aggravated to the level that now I don't want any. Again, the medicines: pulsatilla, phosphorus, capsicum, ammonium carb, fluoric acid, lead, phelinum, uranium. Now, how can we differentiate? Which medicine can come? Any suggestion? Or you can suggest from Elivina, anacardium, calcarea, China, sulf, kali iodide also. Any suggestion? Remember the aphorism. You will have the medicine. Fluoric acid can be, but fluoric acid will have a Beyonce, no attachment. We need a medicine which have a basic need of insecurity. Fearful medicine. Which are the fearful medicines? Differentiate. Phosphorus, pulsatilla. Moreover, these two. Right? Moreover, these two are more fearful medicine. Differentiate from these two. Whole phenomena, Hahnemann sir has told. Understand the whole phenomena, how the corporeal body has reached to the level of mind. Right? So now phosphorus and pulsatilla. Two fearful medicines are there. How can we differentiate? Phosphorus. Why? More fearful. In pulsatilla and phosphorus, more fearful medicine is phosphorus. The two medicines most prominent for fear are calcarea and phosphorus. So there can be a point of phosphorus. Any other suggestion? Uranium is a esteem medicine. Uranium is a medicine which is highly anxious. Highly anxious. You will you can put it with arsenic. It is so much anxiety about health, but esteemed medicine. That is uranium nitricum. This is uranium metallicum. Nitricum will have an exaggerated anxiety. Uranium metallicum will again have a anxiety, not up to the level of nitricum. So phosphorus or pulsatilla or any else, salt of it, or similar medicine from any family, you can suggest. Sepia, phosphorus, near to say phosphorus. Sepia, more ever indifference than fear. What I thought. अभी मसी तो एकत क्यों फोटो तो तुम्हारे क्या दे मैं दे दी थी यार एग्रीगेशन तुम्हारे क्या दे दिया था बोलो ना हाँ any suggestion I will you will say I will not give suggestion because you will ask why is important કેવું જ કોઈ ના કઈ yes phosphorus and pulsatilla will both of them will do it. Afeminine, it is actually not an effeminate. He doesn't have anyone to share. He only have his mother to share. That's why he's telling to his mother. Calcarea force, timid, shelter. But I prescribe plain phosphorus. Why? Hemorrhagic diathesis. He had 2 times bleeding in the stool. Hemorrhagic diathesis and fear. What Vimal sir has already told us. 1 plus 1 is equal to 2. Homeopathy is mathematics. Hemorrhagic diathesis is there directly in a reference of phosphorus. So phosphorus was given, followed. Antipsychiatric medicine are started reducing from the next month of prescribing phosphorus. That was from psychiatric doctor. This is the first sign of right medicine. Starting having enthusiasm in work and joy in life, is now having good professional and family life. His sinus started improving and nervousness started decreasing. He is now comfortably telling his symptoms. Again, our question. Until and unless this is being solved, we will not say this patient is cured. Restoration of sick to health. Yes, I am ready to get married. Patient. I will have a child. I don't have thoughts of killing my child. I think I have a sexual relation with wife. He is ready for marriage. I am not asked about girlfriend. Sorry. So he is prescribed 2 doses of phosphorus and 1 dose of phosphorus 1 m till day. I will show his video also after stopping the recording. Right? His stammering also improved. In recent follow-up, his stammering has gone. He has no stammering. Which was till childhood. Why it has gone? Because we have find out the conflict since intrauterine life. His stammering has also gone. His mother was not believing this stammering can go at this age. I think if my medicine will touch, if homeopathy will touch, we can do anything. We also don't know what we can do. That's why we always say, Jai homeopathy. Any question? Any question? Claps to homeopathy. Hahnemann sir.